Okay. So guys, today we're gonna be today I want to speak about the hemolytic uremic syndrome and its high yield USMLE notes. So before I start teaching hemolytic uremic syndrome, I kind of want to assess the students' baseline knowledge and their concepts that they have. So I'd ask questions like, what is your concept of the disease hemolytic uremic syndrome? What do you think is underlying pathophysiology or mechanism behind the syndrome of hemolytic uremic syndrome? And I'll kind of ask them, what do they think are typical symptoms of a patient who presents with hemolytic uremic syndrome? I like to kind of start off by by kind of going through the name of the disease and breaking it down from there. And over here, I would first of all start with hemolytic, and I would engage a student over here as well and ask them what's their kind of concept of hemolysis, and hopefully they would kind of answer like we're breaking down red blood cells, high LDH. And low haptoglobin, which are typical signs for hemolysis and appears in question stems. Then I would kind of ask them what's their kind of concept of uremia, and hopefully, and what type of labs do they kind of expect to see on question vignettes. So that'll be kind of high creatine, high BUN over here. And then what picture that we're painting over here is that we're getting hemolysis from the breakdown of red blood cells. And then we're also getting kidney failure over here, which we mentioned over here. But what's the kind of connection? Because it's not really making sense. The connection is not really making sense. So I want to kind of speak about the underlying cause. So the underlying cause is going to be of this disease, hemolytic uremic syndrome, is thrombosis. And why are we getting thrombosis in hemolytic uremic syndrome? Well, that's because of undercooked meats. And that leads to a very deadly bacteria called E. coli 015787. And that releases a toxin called the Shiga toxin. Shiga toxin damages endothelium. It specifically damages endothelium, which is called the GB3. It attaches to a molecule GB3, which is prevalent in renal glomeruli. So basically, this toxin causes a lot of microthrombi and damage to endothelium in renal glomeruli and causes a prothrombotic state. Now, again, I would kind of engage the student and ask them, okay, so if red blood, if we have microtrauma in our renal glomeruli, what would we kind of expect to see? Like we're getting kind of decreased blood flow, we're not getting enough capillary permeability anymore because there's so much microthrombi. What do we kind of expect to see to the GFR? And hopefully he would answer there'll be decreased GFR. And then I would say like, all the red blood cells passing by, they're going to be shared. So what would kind of happen to the red blood cells? So hopefully he would answer hemolysis. And then I would ask that all these platelets, they're being consumed in this microthrombi. So what would be kind of like what would you I would ask the student, what does he think kind of would happen to the platelets? So hopefully he would answer thrombocytopenia over here. So once I've taught this concept, I would ask them to teach it back to me. I would ask them, what do you think causes hemolytic uremic syndrome? And I'll ask them to walk me through the hemolytic syndrome. Over here, I'll be able to identify any knowledge gaps that they have, something they may not understand, and go through it again. Over here, I have a table of hemolytic uremic syndrome, and I've kind of bolded all of the key words which show up in USMLE questions. So, for example, this disease is very common in children. Secondly, it's a very prothrombotic state, and this is due to a Shiga toxin. Thirdly, I would speak about the triad, which is very important for USMLE questions. That's the basis that we're getting thrombocytopenia due to consumption. We're getting decreased hemoglobin due to hemolysis. We're getting high creatinine due to kidney failure. Differentiating symptoms would be that we're always going to get a bloody diarrhea prodrome. And lab values would be that there's going to be normal PTT and there's going to be normal PT, which helps differentiate this from DIC, as this disease does not involve any coagulation factors. Um, I would kind of end this lesson off by kind of giving a mnemonic, a memory anchor. So we can see that there's going to be H as in hemolytic anemia, U as in uremia, S as in scarred red blood cells, or S as in schistocytes. Towards the end of the lesson, I will also kind of go through a USMLE style question. So over here, and when I do a question with a student, I always try to start off with the last sentence. So which of the following is the most likely underlying mechanism of this patient's condition? And the next slide, I have kind of bolded all of the high yield information. So for example, a 4-year-old boy, as this disease occurs in a boy, there's going to be decreased urine output as this patient has kidney failure. This occurred 1 week ago with bloody diarrhea, and there was undercooked hamburgers. And then lab values, we did speak about low hemoglobin because hemolysis. We did speak about low platelets due to thrombocytopenia. We did speak about high creatinine due to kidney failure, and we did speak of schistocytes as a scarring of red blood cells. And the question is asking the underlying mechanism. And the correct answer is Shiga toxin mediated endothelial damage. I would then, and also now ending the lesson, I would kind of give them homework and Anki flashcards. So, for example, what organism typically causes hemolytic uremic syndrome? So the answer would be Shiga toxin producing E. coli. And here's some more examples of homework and Anki flashcards. And my teaching approach has really six key principles. First of all, is to assess their baseline knowledge, assess their understanding. Then to build upon their understanding. And once I've done that, I would want to do the teach back method. Ask them to teach a concept so I can identify any knowledge gaps. And then I would provide a mnemonic as a memory anchor. And then I would give a USMLE style question. And I would always give homework to build our long-term memory and active recall. So thank you very much for your time.